Good morning, Queensland, and good morning to all of our Facebook Live followers. So what I can say today is we have two new local community cases. Now, the first one is a man in his 50s and he lives at Carrara on the Gold Coast. Now, he is an Uber driver. He is fully vaccinated, which is good news, but we need to contact trace people who were in his Uber. So once again, now we have, this one is unlinked. So I am really saying to the residents of Gold Coast, if you have any symptoms, please come forward and get tested. If we see more unlinked community transmission on the Gold Coast in the next 24 to 48 hours, we may have to put in place some further restrictions. Therefore, people should consider on public transport on the Gold Coast, they should consider about wearing a mask, but also too if they are in crowded situations. So we want to protect people on the Gold Coast, but we do now have two unlinked cases on the Gold Coast. So please, Gold Coast is not at that 80% yet. You're doing a great job, but we just don't know where these cases have come from. So the person has been taken to the Gold Coast University Hospital, and as I said, contact tracing is underway. Now, the second case we're not as concerned about. It is a young woman in her teens from Beaudesert. She is a close contact of a confirmed case from that Moree cluster that we talked about the other day, and she was tested in home quarantine. So she spent a couple of days infectious in the community in Warwick and half a day infectious in Beaudesert. So once again, in Beaudesert and Warwick, if you have any concerns, please come forward and get tested. And the third case was overseas acquired in hotel quarantine. There have been 8,943 tests in the past 24 hours. So once again, thank you Queenslanders for coming out and getting tested. If you do have any symptoms, please come out and get tested. Good news, Queensland Health did 17,324 vaccines yesterday. This is tremendous news, and it's not too late to come forward and get your vaccine. It was great to be out at Cherbourg and travelling around the community yesterday, and to see how good our Queensland Health officials are with local community leadership going out and encouraging people to get vaccinated. So well done to those local communities. Therefore, we have now in Queensland, we've reached that 80.1% of Queenslanders have had their first dose. So well done. That is a tremendous milestone that we've hit, and 68.31% are fully vaccinated. So we need to continue to drive up those vaccination rates, and as I said, in Brisbane they're heading towards 90%, but in some of our communities in regional Queensland we do need to continue to lift those vaccination rates. So to that end, yesterday afternoon, to the relief of many people living in those 11 LGAs, masks were removed. Now, that is fantastic news, but of course, if you feel like you should put a mask on public transport, the discretion is up to you, and of course, if you are in areas where you can't socially distance. But as we continue to climb above that 80%, that is great news. So to that end, we want to make sure we still have options for people to get vaccinated. So this weekend is going to be fantastic. We've got over 50 schools across Queensland to allow more options for people to get vaccinated. Our school blitz have been very successful, but the following weekend we are going to have a super schools blitz, and the Minister for Education will be releasing further details for that on Monday, and later on today we will put out the list of the schools for this weekend. So please, there are a lot of options out there, and if you have any concerns, please go to your local GP and discuss any of those concerns. But I've been very encouraged by the fact that people are still going out there and getting vaccinated. It's safe. The vaccine is safe. Everybody, millions of Queenslanders have done it right across the state, and this protects yourself, your community and your family. So I'll hand over to Dr Aiken.
Thank you, Premier. And as the Premier said, great news today, with 80.1% of Queenslanders having had their first vaccination. That means masks are now off for Queensland as a whole, which is also wonderful news. The sadder news is we do have 2 cases locally acquired in Queensland. As the Premier said, one of those is a male in his 50s. We haven't got the full information yet. We're working through that and unable to find a clear link to how he has contracted COVID. He has done all the right things. He is fully vaccinated. He has come forward and got tested, but he does work as an Uber driver and has been exposed for 3 days in the community, potentially infectious. So we're working through that, contact tracing him. The other case, as the Premier mentioned, is a woman in her teens who's linked to the Moree cluster through contacts with a known case, and she went into quarantine as a result of being in close contact yesterday and has subsequently tested positive. The third case is an overseas arrival, potentially infectious on the flight, but he's in hotel quarantine, he's come from the UK, and that's standard procedure. The big message really today is that's 2 cases on the Gold Coast now. We don't know at this stage how they've come about, how they've contracted COVID. What we do know is that masks are effective. We're not going to reintroduce mandatory mask wearing at this stage. We need to find more information out. I would strongly encourage everyone in the Gold Coast, if they can't socially distance, to please wear a mask, particularly in those areas where there's more crowding indoors where they can't socially distance. The other thing I'd please ask the Gold Coast community do is to use the QR codes, check into those venues, make sure people know where you are, so if there are further cases, you can be contact traced to protect yourself and your family members and your community. The other thing I'd ask is that if you do have symptoms, please come forward and get tested. And that applies to everyone in Queensland, across South West, Central West, the rest of Queensland as well. If you have symptoms, please come forward and get tested, and keep checking the venues as well to make sure that if you have been at a venue of concern, get that message, go out, get yourself tested. And the final part, and I keep saying this, is get vaccinated. That's the biggest protection for our community, is to go and get vaccinated. So take the opportunity, go forth, get a jab, protect your community. The other part, just to finally say, is that for Gold Coast, we do need to watch this really closely. We're concerned. That's 2 cases. At this stage, there are no plans to do anything further, but come forward, get tested so we can get on top of this quickly and early so we don't have more cases, we don't end up having to look at more mandatory requirements as far as mask wearing or restrictions in the Gold Coast community. We don't want that. We want to protect you, so please get tested, get vaccinated. Thank you.
Building on the previous successful pop-up vaccination hubs at schools, this weekend we'll have over 50 schools, which is around 3 weeks after the very successful pop-up clinics we had recently, will be opened in over 50 schools right throughout Queensland. And as the Premier has just stated, we'll have a super vaccination pop-up in schools the following weekend. We hope to get information out on the super weekend as soon as possible on Monday, and we'll have the website updated about the over 50 schools that will be open this weekend. So if you're 12 years and over, now is a great time to use safe facilities to go in and have a vaccination. And I've met many 12-year-olds and over who have gone to the schools, with the vast majority being first doses, and that's really good news. They've proved to be very successful in the past, and we're hoping that they'll be even more successful coming not only this weekend but the super weekend the following weekend, and we'll provide those details as soon as possible. Queensland Health linking with education is a great way to provide safe vaccines, and we're even going in on Friday so that school-aged children in high schools such as Mergen State High, which is open Friday and all weekend this weekend, where you can go in and get vaccinated if you haven't been vaccinated already. This is great news because, as I said, most of them are getting their first dose. So whether you're getting your second dose, of course, if you haven't had your first dose, come out again this weekend to get your first dose. And we want to see as many people as possible in our schools that are staffed very well, and of course for the super weekend, the following one. The message is clear. If you haven't been vaccinated, it's very important that you do get vaccinated, and we're providing every opportunity for you to do that. And schools is a great safe place for you to come in, and your family and your friends and anybody else to come in and receive your vaccination. So very proud to link with health. So we've got these schools open this weekend and a super weekend starting on the next weekend, the 20 and 21 of November.
Thank you. Good morning. If I could just touch on some of the changes and what they mean. So we've already seen that having reached 80% first dose, that mask restrictions have been eased. We are on track to meet 70% double dose next week, as you are well aware. The major change to there will be in relation to home quarantine. And I know that the home quarantine trial was focused on returning Queenslanders. The simpler way to understand what's happening with that is that anyone that can meet the home quarantine requirements will now be able to apply for a border pass and come in home quarantine. So the system we're using for that, we're doing the testing of that at the moment for the online application system, and it's working well, so we will be ready to do that. For all of those people, and there's over 14,000 in that system at the moment, they will be advised on the changes to the system and what they need to do to be able to apply. There will be no hierarchical progression of that because they will be qualified. If they're qualified, they'll be able to come into the state. So that advice will be coming out in the coming days before we turn the system on. With respect to our road borders, the Australian Defence Force, I should note, is pulling out as of the 15th from our road borders. This has been planned for some time. Can I thank the ADF for the wonderful work they've done with us all through this pandemic, and the absolutely sterling job all of their members have done working with our people at our borders and also in our hotel quarantine arrangements. So we have been expecting this and we are planning for that. But I just want to assure people that they're not going to see a wholesale changes at our road borders at this stage. When we hit 70%, we will see a very similar posture. Yes, we are looking at making sure that we can do it as efficiently as possible to keep things moving, but you will see much the same at our road borders until we get to 80%. So we are planning through that, and I'm just going to touch quickly on 80% because it seems to be getting a lot of attention. Can I just note that we are still a month out from that, so we are doing very detailed planning around how we're going to operate all of this, including the compliance regime, and are testing all of our planning around that. But the key message to all people out there is that once those arrangements come in at 80%, if people choose to blatantly disregard the Chief Health Officer's directions, they can expect us to take action. Thank you.
Is it the 15th of November or December for the ADF pulling out?
15th of November. From the road borders, so there's a progression then on what we do with hotels. Thank you.
Premier, while we're talking about the 80% vaccination rules, when you plan to review them at 90%, is that with the view to drop them, or do you envision that they'll stay in place permanently?
Look, we have no plans to go backwards at this stage, so it will stay in place and we will reassess.
Is the trigger for the Gold Coast one more case that's unlinked or a handful?
We will look at each case and how they all factor in, but I would not like to see multiple unlinked community cases over the next few days. So look, it's a really important message to Gold Coast residents to please go and get tested, or if you haven't been vaccinated, go and get vaccinated. The difference we have with, if you remember Gundawindi, they had very, very high vaccination rates, okay? They were like 97% first dose and I think over 80% double dose. We don't have that on the Gold Coast. So I am concerned and we need to make sure that we monitor this over the next 24, 48 hours. Sorry, Tim?
We're seeing the mask restrictions go off now.
Yes.
Just as we're seeing new cases. I know you say you're going to introduce mandatory masks again or any new restrictions, but what is the trigger? What would need to happen for you to actually do that?
In terms of the Gold Coast?
Back masks, either on the Gold Coast or in Brisbane?
You know, people have discretion. You know, I think people know now when they want to use masks and when they don't want to use masks. And I think if we saw a large number of unlinked cases, I think you would see the community put masks back on.
The Gold Coast haven't really put them on.
Sorry?
The Gold Coast haven't really put them on much at all in the last few weeks.
Look, I have seen Gold Coast residents using masks, but I think this is a good wake-up call for Gold Coast that this is happening in your community at the moment, and let's get on top of it quickly and safely.
What date in January are we expecting to hit 90%?
I don't have that at the moment, but I think it was around early to mid-January. Yeah.
Will restrictions for the unvaccinated people stay at 90% or will they drop off then?
Yes, they will. They'll stay. They'll stay.
Until what time?
Sorry?
Until what time?
We will review it, like we said, at each stage.
Premier, when we get to 80%, we know that there's going to be big lines at our border checkpoints.
Yes.
Lots of people coming in
there will be, and police at the moment, as you heard from the Deputy Commissioner, they're doing all of that detailed planning work, but people need to know that there will be delays.
Should a preference be given to Queenslanders trying to come home?
No, we can't do that. Like, at the moment, we know that Queenslanders are coming back through the airports, but there's going to be a lot of people wanting to come through the borders, so that would be probably impossible to do. But we want people to come through safely. So the police are doing all of that planning at the moment.
Given the vaccination rate on the Gold Coast isn't at 80%,
Yes.
are they at risk of a lockdown if there are more cases?
Not at the moment, but let's see how it goes. You know, this is, let's see in the next 24, 48 hours how we go. I mean, the good news here is that the man, the Uber driver, he was fully vaccinated. So that's good news. So less likelihood of it being transferred. I remember we had the case up in Cairns. We were very lucky as well. But the other thing is, can I say to Gold Coast residents, you must check in when you're in an Uber and when you go to restaurants. It is going to make our contact tracing so much easier. So please do the right thing and check in.
Were people checking in with this Uber driver? Were customers checking in?
We're going through his records at the moment.
And why not consider a lockdown now, given the unhealthy cases?
Because of the high vaccination rates. Like, we are not at 10% or 20%. The Gold Coast is nearly at 80%, but we just need to see what that transmission is going to be like in the next 24, 48 hours on the Gold Coast. Last couple of questions. I've got to go to a Remembrance Day. Yes, that's right. That's why. Correct. Yes. Correct. Yeah, I do have concerns, and that's why I'm saying very clearly today, and please, everybody, get the messages out. We really need to see Gold Coast residents, A, get vaccinated, and B, get tested. And I'll be looking at the testing rates on the Gold Coast.
If people are double vaccinated, Premier, if they're double vaccinated and
They have less likelihood of passing it on. Correct.
And if they have a negative test, but they are in close contact with one of these cases, do they still have to isolate for 14 days?
I might get the Deputy Chief Health Officer to address that.
Yes.
Yeah, two more. Yep.
There's been a big focus on the vaccine rollout in schools. What's being done at universities, given that age group has
My understanding is that the universities, when I spoke to some of the Vice-Chancellors, they were actually putting clinics at the universities to get people vaccinated. I hope so. I hope so. I think young people want to go out and enjoy catching up with their friends and families. So we've seen an increase in the vaccination rates just with Queensland Health, and I would expect to see an increase in vaccination rates today from people going to their GPs and their pharmacists.
Are there going to be clinics at schools?
Sorry?
How's the government going to roll out the vaccine at schools?
Yeah, we'll probably have clinics down there as well.
Is there a situation where the government will consider reopening international travel at 80%?
No.
How's the search for the new Chief Health Officer going? Are we any closer to having one? And do you want one by December 17th when the border opens?
Look, that process is underway. They've reconvened the panel, and there should be announcement next couple of weeks.
Premier, as we move to home quarantine and see less hotel quarantine, we know over the pandemic we've seen a lot of heartbreaking cases. People applying for exemptions that haven't been granted. We all know that Queensland's done well, but do you have any regrets as to how that was handled?
Look, the exemptions unit have tried their hardest. Everybody are humans. They wanted to make sure that Queenslanders have been protected, and I think you only have to look at the statistics too to see how well Queenslanders have done. These decisions have not been hard, have not been easy. They have been difficult and hard, and people have tried their very best. But now, as our vaccination rates go up, it's going to be a lot easier for people. And the home quarantine system for fully vaccinated has worked extremely well. We have only seen in our trial one person test positive, and there has been a very, very high degree of compliance. So as long as that compliance continues, this is great news, and it's great to have that evidence from that trial, which now means that we can expand it when we hit that 70% double dose.
Got to go. Thank you.
Thanks, everyone. Thank you.
Thanks, everyone.